COVID and racism in the U.S. by the Yellow Pages. Next slide, please. In Chicago, more than 50% of COVID cases and 70% of COVID-19 deaths involve Black individuals. Although Black individuals make up only 30% of the population. Yancy Clyde, Journal of the American Medical Association. This means that out of the 5,273 confirmed deaths at the time of making this presentation, 3,700 of those deaths involve Black individuals. Other cities in the U.S. have the same problem as well. And Black people are 2 times more likely to die from COVID-19 and 5 times more likely to be hospitalized from it. And with COVID-19 cases rising, why are a majority of the infected people part of a racial minority? Next slide, please.
Racial inequalities have been highly exposed during the COVID-19 pandemic. Dylan Devakumar, an associate professor in child and adolescent health at the Institute of Global Health at the University College of London, explains this situation by saying, rather than being an equalizer given its ability to affect anyone, COVID-19 policy responses have disproportionately affected people of color and migrants, people who are overrepresented in lower socioeconomic groups, have limited healthcare access, or work in precarious jobs. Debit Kumar presents a significant problem, which is that inequalities have reflected in the health of colored Americans, causing COVID to affect people differently by race. He states how colored people make up the majority of lower socioeconomic groups, have limited healthcare access, and work in high-risk jobs. All of these factors contribute to how COVID has disproportionately affected colored individuals. Nancy Shue, editor-in-chief at Science News, provides further context to the situation by saying, the coronavirus pandemic has tracked long-standing racial fault lines in the United States, with African Americans more apt to become seriously ill or die from COVID-19. Black people often work in jobs where they are more likely to be exposed, more often have other health conditions that put them at greater risk, and have less access to care. Shue elaborates on this problem by emphasizing the colored Americans' jobs typically have higher exposure to the virus, although they do not have the adequate access to healthcare for a variety of reasons. Adia Wingfield, a professor of sociology at Washington University in St. Louis, explains that one of these reasons is because, in healthcare, for instance, this can mean pay policies that discourage practitioners from treating patients who are affected by poverty, discrimination, and other factors that can impair health. Due to these unjust situations, people of color have been disproportionately represented in COVID deaths. According to Jeremy Gold, Black and Hispanic Americans collectively account for 42.9% of deaths, although they only make up 31% of the U.S. population. These statistics prove that it is absolutely necessary for us to address these inequalities. Next slide, please.
Our first solution involves diversifying the field of professional medical people. This is related to COVID-19 as shown in the problem, which is that mainly Black and other minorities are contracting the COVID-19 virus and dying from it. The graph on the right shows that Black Americans only make up 5% of the professional medical field, where white Americans make up 56.2%. By diversifying the medical field, we can better treat Black individuals by understanding the problems that they have and the areas that they come from. Adia Harvey quotes, "None of these policies is necessarily a result of individual intent, over-bias, or malice, but ultimately individuals are the ones who credit social institutions. When most of these people are white, it is all too likely that they will fail to recognize the particular realities of life for Black citizens." This, end quote. This further solidifies the fact that understanding people and how to treat them is absolutely necessary. Also, Leslie Nedger quotes, "Due to the institutional mistrust among many in the African American community, non-Black institutions must train trusted Black institutions, medical personnel, and social workers of color, church community, and community organizations to increase equitable treatment of individuals of color, end quote. This means that we cannot just hire black individuals to diversify the field of professional medical people, but it must be the right black individuals, and they must have the correct qualifications. Next slide, please.
Another solution to consider is to improve funding for healthcare and insurance. This would set up funds and donations charities to be able to go toward the help of healthcare for others. Next slide, please. The Affordable Health Care Act, which is also sometimes referred to as Obamacare, is a system that offers affordable health care to those in need. This graph by the Kaiser Family Foundation shows the positive effect that funding can have in reducing health care disparities. Each colored line represents the percentage of people that are uninsured in each ethnic group, as shown by the specific color. The highest rates of being uninsured are seen in the ethnic minorities of Indians and Alaska Natives, Hispanics, and African Americans. Being uninsured can translate into more limited access to healthcare and poorer health outcomes. With the funding and implementation of the Affordable Health Care Act, the percent of being uninsured went down across all ethnic groups, but was especially remarkable among Hispanics and African Americans. And as you can see here, a government-funded program to help this would be able to make a big impact upon the healthcare of individuals, especially in this time of COVID-19, where additional help would be needed. Next slide, please. Alongside government funding, private funding can also make a difference. This is an example of a program that started with private funding, which even led to grants from the government. And this study was designed to reduce the high rates of severe asthma in Hispanic and African American children. Those in the program had significantly reduced hospitalizations and emergency room visits for asthma. And this proves that private charity can also reduce healthcare disparities. Although COVID and asthma are very different, they are alike in which the prevention and education can help improve the disparities. This also shows that a private charity donation could also help, and it might not have to be government run. Next slide, please. However, there are some limitations. These funds could be used incorrectly, or they could be used inefficiently, which could make the program not as efficient as it could be. There also could be a lack of support, which could mainly be inside of the private funding, since this could also just make the whole entire thing fail due to the lack of foundations. And limited communication could also support a lack of funding due to a lack of communication ending in less people knowing about it and being aware and making a difference. Next slide. However, from this solution, if this solution is to succeed, racial minorities would be able to receive better health care if they need help with this. There would be no harm in setting up donation funds, be it governmental or private. This is very realistic since charities have been successful before, and there are multiple websites such as GoFundMe, which help bring power to issues that are in need. Next slide.
While both of these solutions can help solve the problem of the racial inequalities of COVID-19, we ultimately decided that solution 1 will be more effective. When we hire more non-white medical professionals, it will make it so that the medical field more closely resembles the diversity of the population. If we hire more minority physicians, they'll understand the hardships of being a part of a racial minority and why they're more affected by COVID-19. None of these policies is necessarily a result of individual intent, overt bias, or malice. But ultimately, individuals are the ones who create social institutions. When most of these people are white, it is all too likely that they will fail to recognize the particular realities of life for black citizens in the field. If we hire more doctors and more non-white doctors and if we hire more non-white doctors and physicians, they will be able to help out racial minorities and reduce bias. Next slide, please. These are.
Okay, not bad. You guys need to do some editing because you're running long. And I let you run long because I could tell you were pretty close to wrapping up. But yeah, you guys were